Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everyone you know to listen to the show, available on podcast apps worldwide. If you have a question or an idea for a future program, share your idea with me, pose your question by commenting on my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also go to my website, click on the Contact Me button, and complete my caregiver survey and pose your question there. Welcome to the Caring Generation and this week's episode number 178. Why elder care and Medicare is more expensive than you think. Caregivers and adults over age 65 are shocked to learn that elder care and Medicare are ridiculously expensive. Some would say they're just plain old unaffordable. So during this podcast, we're going to talk about three things. Why the transition from work to retirement and dealing with healthcare costs can be quite a challenge. Number two, how having an early understanding of healthcare costs can help you think differently about planning for retirement. And number three, why planning for changes in health, including the costs, is really a very practical approach to aging. When you think about work, there are many considerations around transitioning from working full-time or even working part-time to retirement. And while so many people I know dream of retirement because they don't like their jobs or they just want to avoid work pressure, what most people don't realize is the pressure and the stress doesn't end. The pressures of life that were work-related just move over to another part of your life. Now, on one hand, your daily routine changes. You may not have to wake up anymore at 5 a.m. to get to the office or to start work by 7 a.m. Maybe you sleep in. All of those daily meetings that you loved or hated are suddenly gone when you retire. The effect of not having a daily routine may result, though, in feeling alone or isolated because you no longer have this group of colleagues or friends that you spend your days with. I think it'll be really interesting to see how remote work might shift actions toward creating more social contacts outside of work. Because the office, if you work remotely, is no longer that place where you socialize and you're constantly around people. Your socialization today happens outside of the workplace. I think that the effects of this change to remote work may not really be realized until a lot of years from now. It'll be interesting to see what happens. So let's talk about full-time work to retirement. Let's talk about income. While you're employed, there may be a lot of opportunities for yearly raises, receiving promotions, or other ways to increase your income. When you retire and you stop working, you live on a fixed income that includes your Social Security earnings, maybe a pension, depending on where you work, and then the money that you invested or saved, plus if you own a home, you may have some home equity. When monthly income does not change in retirement, and the world continues to change, this can really result in a bit of a panic if you don't have what I call a cushion between your monthly income and your monthly expenses. An example of this would be having an income of $2,500 a month, and your expenses are only $1,500 a month. So you have a $1,000 cushion between your income and your bills that you can choose to do whatever you want with. You can save it. You can use it for travel. You can use it for other enjoyable pursuits or things that you need. But what is going to happen over time is this $1,000 monthly cushion is going to start to erode. It will shrink as the costs of things like gasoline, electricity, food, medical care, and other services continue to increase. So to make this real, I want to share some numbers with you by comparing the value of money from 2010 to 2023. This is over a period of 13 years. So if you're 65, or really any age, this comparison will give you an idea of how income today will be able to cover your expenses in 13 years. So if you're 65, how will your income be paying your bills when you're 78? And if you're listening to this podcast and you're not listening to it on my website, I will include a link to the reference that I'm about to cite in the show transcript so that you can visit and take a look at it and see all of the details, because there's a lot more information in this article. So the value of $15,300 in 2010, when we compare that to 2023 today, it's equal to $21,596.16 in purchasing power. So what this represents, that difference between the $15,300 and $21,596, is the effect of a cumulative price increase of goods or services. The percentage of that price increase is 41.15%. That's huge over 13 years. This means that prices in 2023 are 1.41 times higher than average prices in 2010. So here's some practical examples. Gas prices, 2010, $2.73 to today, $3.99 in 2023. A loaf of bread, $1.36 compared to $1.97. Eggs, $1.79 to $2.06. A whole chicken, $1.27 per pound to $1.90 per pound. And electricity, and this one's a little hard to understand, but 12 cents per kilowatt hour to 17 cents per kilowatt hour. Now, these numbers that I cited are averages, so depending on where you live, the increase can be more or it might be slightly less. And when you look at the effects of cost increases and inflation by what we call category of goods, the categories most affected are going to be housing, food and beverages, medical care, and transportation, which, if you've been paying your bills, this is probably no surprise to you. So if you translate these numbers to your retirement income and the amount you have to save, and you make the assumption that every 15 years, there's going to be a 40% increase in what you're paying for, that can be a pretty scary thought if you're not thinking today about planning for retirement and paying for care costs, or if you're already 65, you might be really concerned about how on earth you're going to pay your bills. This crazy increase is one of the reasons that many people I know, myself included, I'm going to probably plan to keep working after age 65 so I can save money to create a cushion against these future cost of living and price increases, because honestly, I'd like to live to a really healthy old age and not have to worry about paying my bills. We can hope that for every one of us. Now, you may have heard that living costs decrease when you retire if you're currently working. Well, maybe not. If you work remotely, this may no longer even be accurate, because if you don't have to commute, not only are you saving time, you're saving transportation costs. You may not need or be a household that needs 2 vehicles anymore. You may be able to get rid of one of them and save that money. If all your meetings occur over virtual platforms because you work remotely, you may only need a few really nice shirts or tops or jackets. You might not have to worry about skirts or slacks or shoes anymore, right? You can work from home wearing jeans and slippers. And if you're a woman, other things like getting your nails done, well, maybe you don't have to do that so often. And if you can work remotely and you live in an expensive city, you may also be able to move to a suburb or a less expensive area of town if physically you don't need to live near this building where your office is located. A lot of companies today are giving up their office space to become remote-only workplaces. And as stressful and crazy as the COVID-19 pandemic might have been, that experience has changed so many aspects of life for the better and maybe some for the worse. One of the most relevant aspects of this conversation is the change in the provision of healthcare services, and in many cases, this has been a really good thing. If you have a doctor, you may know that remote appointments, virtual appointments, video appointments, they're really common today, especially if your symptoms are not severe and you don't need lab tests, or the doctor really doesn't need to look at you eye to eye or examine your body. Most of the time you can go online and schedule an appointment online. This has been really good for Medicare beneficiaries who may have trouble with transportation to get to an appointment. Now, the downside is that virtual appointments, which are also called telehealth or digital health, can misidentifying health issues that can't be easily seen if you're not able to explain these situations to the doctor. And then we have older adults who may not have access to computers, smartphones, or even internet access. Those people can't participate in virtual health care. And there's a large part of the United States where virtual care is impossible because of very slow or non-existent internet connections. Rural or these less populated areas without internet might be really challenging to imagine if you live in a major city like Los Angeles or Dallas or Chicago, and you never leave the big city to go to these flyover states where farmers and ranchers and similar producers live and work. They could live out in the middle of nowhere, with the nearest house being miles away, with the nearest city being miles away. So in these areas, even while working, accessing healthcare services can mean that a person has to take time off work to drive an hour or a couple of hours to a larger city that has medical clinics, hospitals, and other services. When we relate this to healthcare costs, like access to Medicare Insurance and services not paid for by Medicare, the time and the numbers can quickly add up. Believe it or not, some areas in the United States don't have a hospital nearby, no nursing homes, no assisted living, no home health services that people who live in big cities assume exist everywhere. If you live in one of these areas and you get sick and you're going to need continuing care, you may actually have to move to access that care. And that move from a small town or rural area to a large city can be very costly. But let's look at the opposite. When you're younger and you're working, you may have dreams of leaving the big city to live in a smaller town where you can drive across town in 20 minutes, where you go to the grocery store and it's not crowded, where schools are safe, and there's wide open spaces as far as you can see. That might be just a dream that you have. So as you can see, everything living in a big city versus a rural or remote area has pros and cons. The stage of your life, where and how you work, can play a really large part in the quality of your health, ability to save for retirement, and access medical care. So let's talk about number 2 on our list, which is the cost of care. A lot of people I talk to believe that once a person turns 65, Medicare pays for everything and healthcare expenses totally disappear. This is the perfect opportunity to take a short break. I'm Pamela D Wilson. You're with me on The Caring Generation, episode 178, Why Elder Care and Medicare is More Expensive Than You Think. When we return, we will consider this fact about Medicare paying or not paying for everything and healthcare expenses disappearing. You can visit my website, PamelaDWilson.com, for more help and support for caregivers and aging adults. Also, check out my YouTube channel, Pamela D Wilson, Caregiving Expert. There are over 800 videos there answering questions caregivers ask. You can search by topic. Between this podcast, the information on my website, and my YouTube channel, there honestly is something for everyone, whether you like to listen, read, or watch. Please share these resources with everybody you know. Stay with me. I'll be right back. This is Pamela D. Wilson, caregiving expert, advocate, and speaker. You are with me on episode 178 of the Caring Generation podcast, Why Elder Care and Medicare is More Expensive Than You Think. In this part of the program, we'll continue to talk about Medicare costs and why planning for changes in health, including the costs, is really a practical approach to aging. So, if you think Medicare pays for everything after age 65, spoiler alert. This belief is faulty. It's inaccurate. It is not accurate. Healthcare expenses increase, not decrease with age. A lot of people say, retiring saves you money, but as we talked, if you're a remote worker, it may not. The older you are, the more you are likely statistically to have one or more health problems you deal with every single day. And in case you hear the term chronic diseases, this is the term that the healthcare system uses for things like high blood pressure and diabetes and other care. And while Medicare is also a general term, know that there are different types of Medicare insurance and a lot of different Medicare plans, actually over 4,000 plans in the United States. I know that sounds crazy. The basic ones include Original Medicare. It's that white, blue, and red card that you get in the mail at 65 if you go to the Social Security Department and you apply. Then in addition to Original Medicare, there are Medicare Supplement and Medigap plans that work with Original Medicare. And then separate from this, very different, there are Medicare Advantage plans. So if you're looking for detailed information on what these are, how they work, and to identify things that you should know about Medicare before you choose your plan, come to this page on my website, go to my website, click on Media, click on the Caring Generation, and look for episode 178. Embedded on this page is a video it's in webinar form, so it's about 40 minutes. Make sure that you have time to watch it because it does offer a very different perspective on planning for Medicare and healthcare costs. And know that Medicare plans are not free or Those that are free or low cost can offer fewer services, and they can have limitations that you may not like unless you investigate it. So if you follow me, you know that I do my best to give both sides of the story, to balance opinions, and to provide you with enough information so that you can do more research and come to your own conclusions about what you want to do. So separate from Medicare, Medicare Supplement, Medigap, and Medicare Advantage plans, there are services for people over age 65 that you can pay for privately, or if you voluntarily qualified and purchased long-term care insurance, that insurance will pay for these other expenses. If you have long-term care insurance, consider yourself very fortunate. Plans today can be very costly unless you buy them early in life, like in your 20s, when you are in near perfect health. So if you're young and you're listening to this, look into long-term care insurance. I highly recommend it for exactly the reasons we're going to talk about. The services that Medicare does not pay for, and this could be copays associated with Medicare or the services I'm about to share, they can quickly drain bank accounts if you need this care. And so for this reason, a lot of consumers say that, elder care and Medicare and all this health plan stuff, it's unaffordable. And there's this gap between health insurance that you can afford and health insurance that you might have that could have these ridiculously high deductibles that you can't even afford to pay, that really results in more healthcare problems. People don't go to the doctor if they're sick because they can't afford to take time off work. Maybe it's too far to drive. But if you could take time off work, some people still don't go because they're worried about having to pay a deductible or co-pays or pay for tests. Now, on the other hand, some people don't want to go to the doctor because they don't have one, or they don't want to hear bad news about a health diagnosis. And then also, some people have had such a horrible experience with doctors that they see absolutely no reason to ever go back and put themselves in a similar situation. I understand it because in the years that I've worked in healthcare, I have had similar experiences. Add to this that there are communication gaps between healthcare providers and consumers, specific to just being able to understand a healthcare plan and what it pays for and what it doesn't pay for and how it works. And then you've got general healthcare information. So on the topic of care costs, let me just offer some quick ranges. In-home caregivers can cost anywhere between $20 to $60 an hour in 2023, depending on where you live. Assisted living or a memory care community, which is like an apartment where older people live, anywhere from $3,000 to $15,000 a month. Nursing homes, anywhere from $150 to $5,000 a day. That quickly adds up into $5,000 or $10,000 or $15,000 of dollars a month. And honestly, these are expenses that most people can't afford. Medicare does not pay for them. The only way Medicare pays is if there's a hospitalization and a short-term medical stay. Then it'll pay for a nursing home or a rehab. So when you think about these costs and the rate of increases for consumer goods at about 40% every 15 years, if those rates stay consistent, what is your plan, your financial plan? To be 65 or older, be able to pay your rent, your housing, your food, utilities, other bills, pay your Medicare premiums, your co-pays, your deductibles, and then pay for anything else that Medicare does not cover. When you think about these expenses, it can be really scary. Maybe you'll start thinking about saving the $8 that you spend when you drive through Starbucks every day. Or maybe you'll wait to buy another pair of tennis shoes until the pair that you have is just about falling apart. Or maybe you don't have any extra money and you're worried about this. Consumerism, all this advertising we see on TV that tells us all these things that we need, and this desire to have and buy things really does create an opposite perception of life that contradicts saving money for future things that really, if you're healthy today, you can't even imagine it unless you are a caregiver for an older adult and you're going through these things. So some caregivers will say, well, why should I plan if I don't have any money or if I'm low income? And then I have other people that say, oh, I don't need to plan. I make so much money. I can just pay for it. I don't need to worry about it. I don't need to worry about insurance. I'll be good. Well, somewhere in the middle of these very opposite perspectives is reality. And so let me just share some experiences from my care management and professional fiduciary days. As many of you know, if you've been here before, you know that I've worked in aging, caregiving, and health and managing care costs for over 20 years. Because I manage the care of adults over age 65 and younger people with disabilities. And I'll say that no matter how much money you have, if you have none or if you have millions of dollars, when health care problems strike, the amount of money that you have, yes, it can pay for care, but it does nothing to remove or resolve the emotional and the physical distress that you or the person that you care for or your loved ones will experience. Having money is not a cure for health problems. It can't stop a loved one from dying. And I'll tell you, when a loved one needs care, there's never enough money to take away the pain or distress of the situation. Caregiving and aging health problems are something that all of us will experience if we live long enough. Many people I know want to die quickly and painlessly and die in their sleep. They want to go to bed and not wake up the following day. Many caregivers tell me the same thing. They feel this way because they are so emotionally and physically stressed due to the tasks and the time to care for another person. They would rather just not have to deal with any of this. Being a caregiver for somebody is not for the faint of heart or the weak. It's hard work. This is why having this discussion that we're having today, why planning for potential changes in health and the associated care costs can be beneficial to reduce worry later if you're in a position to make this happen. Honestly, not everybody is. For these individuals who are beyond this, right? You didn't learn about health prevention. You didn't know about the costs of care, what Medicare pays for and what it doesn't. You may be in a situation where it's just too late to plan, or you don't have the money to plan. For you, there is something called Medicaid. And Medicaid is a federal government program that I talk about. There's videos on my YouTube channel, articles on my website. It has different names depending on the state where you live. And it's a program that is funded through tax dollars to provide care for people who otherwise cannot afford to pay for care. So if you have a steady job, a well-paying job, honestly, appreciate your job and save money for your retirement years so that you don't need to rely on Medicaid. So now let's talk about working with the healthcare system and what that entails. If you're healthy and you're not a caregiver for somebody in your family or a friend, you might have very limited experiences with medical offices, doctors, hospitals, other healthcare providers. The best way to plan for potential health changes is to actually, it's going to sound crazy, but start using your healthcare insurance. Create a relationship with a primary care physician who can get to know you. And I know many of you are saying, well, Pamela, why would I do that if I'm healthy? The answer is so that you can stay healthy longer. And you might ask, well, why would I go to all the trouble to find a primary care physician when if I'm sick, I can just walk into Walmart or my grocery store or a Walgreens or CVS? They have healthcare clinics. The answer, again, is do you want to be healthy and stay healthy longer? And these quick fixes are what I call one and done. So if you walk into one of these emergency clinics or a clinic in a store, it's very likely that the information from your visit never gets placed into your permanent health record. And while the staff at these locations may be very good, they may be qualified to help you, they're not going to be with you for the long run. They're not going to be with you for the rest of your life. They're there to address an immediate concern in the moment and nothing more. If you see a primary care physician who gets to know you, that physician can create a track record of your visits and your blood tests and have information about you in the system. And if you ask, this same physician can help you learn how to prevent minor health issues from becoming more significant later in life. Here's an example. Do you have high blood pressure or any condition? So if so, what can you do to reduce your blood pressure or that condition that is not medication related? Taking medication is good if you've tried everything else, if no alternatives exist, but medications don't really solve the fundamental problem. That problem is still there. It's covered up. The medication takes care of it, right? So if you think about this, if you don't change your habits to address this condition, let's say high blood pressure, and you continue with all of those habits, what do you think is going to happen? Sooner or later, you're going to be diagnosed with another related condition, and then another, and another, and another. And pretty soon, you'll have as many health conditions as the person you care for if you are a caregiver, or you will become the person who needs care. So ask yourself, why put yourself in a position where you might have a health condition that's undiagnosed, and it gets worse, and you become sicker and sicker and sicker? Being sick is expensive. It's costly. My goal in talking about all of these subjects and advocating is to help everybody be as healthy as possible, as long as possible, and to plan and save for care costs so that you can live the retirement of your dreams instead of being retired and being sick or physically tied to your house because you don't feel well. The same goes for marriages and for spousal or partner situations. I know a lot of couples. I've worked with them. Their retirement dreams were sidetracked when their spouse, who refused to go to the doctor or change health habits or take medications, suddenly has a stroke or a heart attack, or they're diagnosed with Alzheimer's or dementia. These conditions change life forever. Why be that person? Why put the spouse, the person that you love the most in this world, in a position of having to take care of you, right? These are things that we don't want to talk about or think about that will eventually come to pass if we don't deal with them. So my advice is, if you have any kind of a health issue, or if you even don't know that you have a health issue, establish care with a primary care physician and deal with your health issues head on, straight on. And so to do this, right, you have to get involved with the healthcare system. So this is going to take us into the area of government-run healthcare. And if you're over 65, the requirements by the Centers for Medicare and Medicaid and other agencies who monitor health insurance programs and hospitals and doctors and everything health-related. If you think that the government is not involved in your healthcare, you are wrong. The government is very involved in your healthcare. So, while seeing a primary care doctor is good for you, educating yourself about your healthcare diagnosis and getting into the weeds, getting into the details of treatment and medication recommendations is even better for you. So let me share another example. Let's say you have high cholesterol and your doctor says, oh, you should take this medication. And there's no mention of like how you could adjust your diet or your foods to eat lower fat foods to lower your cholesterol. Now, the most logical progressive action here is to figure out how to reverse the condition so you don't have to take medications. Now, if you've tried this and the condition doesn't improve, then maybe medications are your best option. But if you're going to do that, if you're going to take any medication, know the risks and the side effects. Do your research on the medication. Do your research on the health condition. Cholesterol medications, if you research these, they are very controversial for the good that they do and the side effects that they create. You may actually need to take another medication to address the side effects that the cholesterol medication takes, right? How does that possibly make sense? take a medication to fix another medication? To me, that sounds crazy. So, to research, I recommend looking for research articles or clinical studies. Don't just look at anything you find on the internet. It's likely to be wrong unless it's based on some facts or some research. So, look for research articles or clinical studies from major healthcare publications. These would be from medical journals like the Journal of the American Medical Association, also known as JAMA, the New England Journal of Medicine, the Annals of Internal Medicine, and the British Medical Journal, or BMJ. But you always want to look at the end of the article to identify what I call conflicts of interest. So a conflict of interest in a medical publication or a study could be something like a drug company giving money to a research lab and the physicians and researchers there who wants to prove something that the pharmaceutical company wants to prove so that consumers buy more of this drug, right? For example, this medication based on this research study, it's the perfect solution for X. Well, maybe. X could be a man who's 65 years old who weighs 100 pounds. X may not be women. X may not be the general population. So these conflicts of interest happen frequently. So as you do your research, make sure you look at the source. And if the source is presenting both sides of the story, if the source is not biased, because you want a balanced view of everything so that you can make your own decisions. And so while you're having all these experiences, let's talk about medical providers who are not perfect. They make mistakes. They can't make a good diagnosis if you don't give them good information. If you don't follow their recommendations, your health may get worse. Communication can be difficult. Medical records and tests can be lost. And because the healthcare system is so large, a lot of unexpected things happen. So as this consumer or the patient or the person over 65, it's really up to you if you are interested in protecting your health, to be proactive and to learn as much as possible so that you can advocate for yourself. To do this, you can research the medical journals, you can contact local disease-specific organizations, join in-person or online support groups, get involved in the legislation so you know what's happening in your state. Because about legislation, most people don't realize that the government controls all your healthcare decisions. The Centers for Medicare and Medicaid manage Medicare and Medicaid programs with your state Department of Health and other state agencies. Legislators in your state propose and vote on healthcare legislation that gets passed without you even knowing about it. So if you don't get involved and figure out how to publicly comment against things you think are wrong, healthcare is going to continue to be out of your hands. Similar to the article research that I talked about, drug companies who pay researchers to prove what the drug companies want them to prove, politicians in your state are similarly paid or funded or given perks by insurance companies, hospitals, healthcare systems. They're put on boards and they're paid hundreds of thousands of dollars a year. And they're paid by all these people who want a specific outcome that may have nothing to do with what is good for you, the consumer. So while it's easy to complain about the healthcare system and elder care being crazy and unaffordable in the United States, and wonder, why is elder care and Medicare more expensive than we think? Can we not do something about this? It's entirely difficult to become an advocate, to become involved, and to do something about it, which I highly encourage everybody to do if you can. And honestly, if you're retired, you've got some time on your hands. Get involved and start advocating. So I'm going to leave you with that thought. I thank you all for being here. Please check out the other episodes and share this podcast with everybody that you know so that we can extend the support, the education, the encouragement, and the love that so many caregivers and people over age 65 and the people who need care, regardless of their age, need. I'm Pamela D Wilson. I am a caregiving expert. You're with me on The Caring Generation. I look forward to being with you again soon, sending blessings to everybody, love to everybody. Sleep well tonight. Have a fabulous day tomorrow, and enjoy each day until we are back here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.